matters. I'm a mom of 3, and I know that when we support parents early on, when we ease stress and we honor dignity, we aren't just helping families survive, we're helping them thrive. And our moms and babies deserve to thrive. So nearly 1 in every 2 babies in Saginaw County will be an RX Kids baby. Yeah. So exciting. These 3 communities account for almost half of our entire births in Saginaw County. They are also communities where moms face real, everyday, significant challenges. And this is exactly why programs like RX Kids can make a meaningful and lasting difference. And the evidence is pretty clear. When families have stability, when stress is reduced, and you can meet the demands of everyday life, health follows. Babies are healthier, moms are healthier, and families are stronger. So for the past year and a half, the health department, along with our Be Well partners, has been working with Dr. Mona and her entire team to bring this transformative program to our community. And the work's been guided by really one simple belief, that supporting families early on is one of the most powerful public health investments that we can make. So today feels like a beautiful way to start 2026. We're starting this year with hope and with opportunity, with a program that affirms the dignity of parents and empowers moms to focus on what matters most, taking care of themselves and their babies. So there's truly no one better to help us kick off this momentous occasion here in Saginaw than the person who has been the heart and the visionary force behind RX Kids. So help me in joining to welcome Dr. Mona Hanna, the director of RX Kids and the associate dean at MSU's College of Medicine.
Yay. Thank you. It is amazing to be here. I feel like it was maybe 2 years ago or a year and a half that we started to have the conversations with so many champions here in Saginaw. It was when Congressman McDonald Riven was still a legislator, and she's like, you have to bring RX Kids one day to Saginaw. I think I pinky promised her. I'm like, yes, we're coming. And Congressman Kildee at the time helped us convene a meeting here to make sure with all the important stakeholders that this life-changing, evidence-based, efficient, effective program could help the families in this community. So we have been so grateful for the partnership with so many of you, especially the health department, that has helped to make this happen. So RX Kids is it's love and it's joy and it's just common sense. It turns out that families struggle the most around pregnancy and infancy. There is no other time in the life course when families have as much of economic instability. Income drops during pregnancy, moms often have to come out of the workforce, expenses rise. And it's during this perinatal period, this around birth period, that when you have economic hardship, it makes a lifelong impact on your health and your wealth. This short window of life of pregnancy, infancy is so consequential. Little babies' brains double in size in that first year of life. So if there was ever a moment to surround our families and our babies with stability, it is this kind of time-bound period of pregnancy and infancy. And that's why RX Kids was developed. It's a short program. I wish it was longer. I wish it was like child allowances in other countries, which is normal. 70% of countries in the world do this. But it's just a tiny, short program to help families during this really, really critical window of life. So we started RX Kids exactly 2 years ago down the street in Flint. And it was never just about Flint. It was to figure it out. Like, is this possible? Can we do this? We cannot be okay with our babies growing up in poverty. So in a spirit of kind of defiance and resistance and refusal to accept the status quo, in a kind of bold move to address an upstream social determinant of health, we decided to, hey, let's finally eliminate poverty for moms and babies. And folks said, no, you can't do this. And we said, we're going to do this, but we're going to start in Flint. As you know, that city down the street has a lot of challenges, very similar to Flint, very similar to Saginaw and to so many other communities in the state. And it was kind of successful right off the go. We were able to leverage state dollars thanks to our incredible legislatures. We were able to leverage philanthropic dollars. And very quickly, we saw incredible impact. a super high participation take-up rate, almost 100% take-up rate, not just in Flint, but now in many of our other communities. That's amazing. Mamas sign up for this. Families sign up for this. It's easy to sign up because it's delivered once again with dignity and simplicity. It's really easy to understand who's eligible because it's everybody in a community. It's not folks who make a certain amount of money or live in a certain or like first pregnancy or high risk pregnancy. It's for everybody in a community. So our take-up rate is really high. We were then able to have other incredible outcomes, more prenatal care at a population level. Mamas go to prenatal care earlier and more often. Because they're going more often, they're getting connected to more resources. Conditions are being detected. They're getting proper treatment. There's less smoking in the third trimester because of that less stress and the more prenatal care, more education. We're also seeing at a population level healthier babies, which is amazing. These are stubborn measures that have been hard to move over time. And we are seeing less premature babies, less low birth weight babies, less NICU admissions, which are expensive and really hard for babies. And we're preventing all of that. Also incredible outcomes when it comes to family financial security. As intended, it's helping families make ends meet. More housing stability, less evictions, improved nutrition security. We just had a paper that came out on improvements in diaper hardship. Like, who knew that was a thing? But that's a thing. Diapers are expensive. Diapers are so expensive. They're not covered by anything else. The number one thing that our families use these cash prescriptions on is baby supplies, and when you break it down, it's diapers. So families have a little bit of an economic cushion that's improving a whole host of other outcomes. And we are so excited that these outcomes will soon be able to come to 3 communities in Saginaw County. When we first had the conversations, we were thinking just the city of Saginaw, but because of the incredible work of this team that raised so much other match money, we're able to expand this program to 2 other high-need communities in Saginaw County. So this program is led by Michigan State University. It's administered by a nonprofit called Give Directly. They are the international leaders in cash transfers. We work with local community champions and other stakeholders in the community to spread the word and to celebrate the program. But this program is not possible without it being a public-private partnership. And what that means is that we have all kinds of funding from all kinds of different entities. And the most important funder is the state of Michigan. So we've got funding from the state of Michigan to figure this out in Flint in the fiscal year 2024 budget. We got more funding in the fiscal year 2025 budget to expand it, and then there's a little complication with that, which we'll probably talk about later. But in the last budget that just passed in October, the fiscal year 2026 budget, our amazing state legislators and our amazing governor said, expand this program. It is amazing. We want you to go big. And so $250 million was included in the state budget to allow us to be here today. It is still a public-private partnership, so we were still able to raise other monies, and other folks will talk about those other monies to make it possible. But we would not be here once again without our amazing elected officials, and that's why I am so excited right now to introduce one of the champions, Representative Amos O'Neill, and to talk about his incredible leadership in this program. So, Representative O'Neill.
Thank you, Dr. Mullen. Thank you for your steadfastness, and we're going to work on that $250 million, make sure it stays put. So, again, first of all, I'd like to really express my appreciation for the Michigan State University and the health professionals, researchers, and our community partners who have dedicated their work to improving the outcomes of Michigan families. Programs like RX Kids remind us that good health policy begins with simple truth. The earliest moments of life are the most profound. When you invest wisely in the beginning of life, we reduce hardship later for babies, for households, for communities, and taxpayers. We all know that pregnancy and early infancy are among the most consequential and vulnerable periods in our families' lives. Yet, too many families, this time is marked by not stability, but by financial stress, uncertainty, and fear. This also is a time when chronic stress is closely linked to poor maternal health and birth outcomes and long-term care development. That is why providing direct, no-strings financial support during this window opportunity is not charity. It's evidence-based policy. It's good public policy. RX Kids recognizes that mothers know their families best and gives them the flexibility and the autonomy to make those choices that work best for their families. When my colleagues on the other side asked Rep. O'Neill, why are you giving money to mothers with no strings attached? I can proudly respond, because the most cost-effective public spending happens early. You know, the adage, an ounce of prevention is better than a pound of cure, right? Or you pay me now or you pay me later. That whole adage is true for early investment. So when families have reliable resources during pregnancy and early childhood, they are better positioned to remain housed, to maintain employment, and to plan their future. This is how responsible government should work. We need to prevent crisis, not just to react to them. And it's all about recognizing that when we trust families, respect their judgment, support them at the most critical moment of life, we strengthen not only their futures, but the moral foundation of our state. I have always said Michigan's strength comes from its people, and we are stronger together than apart. And it depends on the willingness to invest in people. The cost of housing, food, child care, health care, all these costs are going up. And pregnancy is often when those financial pressures are hit hardest. RX Kids will give families the real relief during those difficult periods. When families are supported, neighborhoods are stable, schools are stronger, local economies are healthier, and individuals that support can make the difference between staying in your house, keeping your job, or making those milestone challenges be a thing of the past. And it does this all while addressing maternal and infant mortality rates, which Saginaw has some of the highest rates. And I want to give my shout out to my colleagues, Dr. Pruitt, and the champion of the health department, Ms. Harrington, and all the team partners. We've been working on this for a long time. The foundation, it really talks about the fabric of this community. As we talked about earlier, Saginaw County, the Great Lakes Bay region, has some of the best partners throughout the state of Michigan, and I'm proud to be a part of that. And I just want to thank all of you for your hard work and your dedication, and we're going to work this thing all the way through to the end to make sure our families are stronger and safer. Thank you. I'd like to bring up another champion, our CEO of our Covenant Health facility, Beth Carlton.
Thank you. I just wanted to say, I get asked often, just like you did, as people ask, why are you willing to partner related to this effort? Why does Covenant want to be involved in this? I want to say why it's been involved. First of all, just again, personal, I think 3 is the magic number for me as well, related to children. I'm a lifelong Saginaw County native. I've been here my whole life, which is starting to be almost 60 years. I will tell you, I've worked at Covenant for 37 years. It will be this May. I am a nurse by background. I'm a pediatric critical care nurse by background. Yay, yay, yay is right. And I just have to say a couple of things. We have known problems that Amos suggested in our area here. At Covenant, we have about 3,000 births every single year in the area. Approximately 600 city of Saginaw births. How are we doing related to the care and provision of our moms and our babies? Well, we have some known issues. We have too high of an infant mortality rate in our region. We have low birth weights. We have a 55-bed neonatal ICU, and many times that is full. And many times there are patients there who, had they had a little bit of different intervention earlier, might not have had that same experience or the need to be able to have care provided in a NICU. We have large numbers of children in our area that live in poverty, as was earlier suggested. And many times the hospital asks the question too late in the course of care, why is this happening? What could we do differently? So you heard Dr. Mona talk about getting upstream. You have to think differently about what you're going to do in terms of problem solving when the tried and true methods of yesteryear are not effective. They simply are not effective. So we've tried to address it. We've taken a look at what we think are the root causes. We need to address the financial stress that was just talked about. We need to better understand the vulnerability of moms and babies. So I'll tell you what is really sobering. I came to a meeting in this room. I have the privilege to partner with the Department of Health. I serve on the board of the Department of Health, and I will tell you that literally on the screen what was provided was the financial risk that moms are under in this very vulnerable period of pregnancy and right immediately after the birth of their child. It is sobering to see the fiscal pressure that is on these very vulnerable people in our community. So when you see and hear about and you hear from people the choices that they're making in terms of what they can spend that very valuable fiscal resource on, they're making decisions about, do I eat? Do I go to work? Do I have transportation? Do I have food? Do I have diapers? It becomes just so sobering to hear what they are facing on a day-by-day basis. So ultimately, we have to make a choice about, are the things that we're doing too late in the game, and is there something different that we could do that is creative? And then enter Dr. Mona, right? My eyes and my ears were opened when she presented related to the power of this program and what had already early transpired in Flint regarding this program. So where it literally provides empowerment for people who are in a precarious position, trying to figure things out, trying to sort it out, and allows them the opportunity to engage, number one, to basically state their circumstance, number two, and then provides them a resource that gives them a little bit of strength to be able to determine sort of their own particular course and have a little bit more empowerment in their own particular course. It has proven outcomes. And so there's a lot of people who might be naysayers. You cannot dispute what happens here when you give these resources to moms. There's a proven increased connection with knowledge and information and interface with healthcare. That is amazing. It is not disempowering to do so. We're not making somebody feel small or feel like they have to be reliant or needy. They get to be empowered to choose how they spend the resource. They are spending it on just what Dr. Mona suggested: transportation, baby supplies, utilities, rent, food, not frivolous kinds of spending. They are spending it where it is dramatically and necessarily important. And so my answer related to when she put the presentation up and we all participated in that was, wow. How can we all become engaged and involved and make sure that Saginaw County is enriched for the good related to this program? So it was a very easy decision for Covenant to be able to be a part, and we are very proud to help this get traction and press, and we think it's going to be very important for the success of our most vulnerable and our youngest members of our community. So Covenant, along with other partners, are very, very pleased to be a part today. So I thank all of you for being here, and I'm going to turn it over to another partner, Miss Renee Johnston with the Saginaw.
Well, thank you, Beth. And what an exciting day for Saginaw County. I tell you, that in itself deserves another round of applause, right? You know, and it truly is exciting too. Beth and Chris and Rep. O'Neill, they all mentioned that we are surrounded by some amazing people in this community. I too, a long-term resident and born here in the city of Saginaw, couldn't be more proud of our community. And today, all of you in this room truly shows why we all need to be proud. We all have come together with partners just down the road who see no boundaries, right? We see good practices with great results. Why not share? Why would we have to recreate the wheel when we have amazing partners that come and share and advocate? You have to know that Dr. Mona didn't just stop in Flint, right? She is out pounding the pavement for the rest of us, for the state of Michigan. So God bless you, Dr. Mona, for your leadership and your support. So she deserves a round of applause. The Saginaw Community Foundation is so proud and honored to serve as a fiscal sponsor for this program. Our mission is to bring people and resources together for an equitable community and to make a lasting philanthropic impact. And that is what you see today, right? It's the Community Foundation working with all these partners, right? Bringing resources, whether it's financial resources, people resources together to address a need or an opportunity in our community. The Saginaw Community Foundation is so blessed to manage donor advised funds that we can have long-lasting relationships with, that we can match or propose opportunities for them to consider to fund. And that's exactly what happened with RX Kids. In addition, the Community Foundation has amazing partnerships as the ones that are in this room today that allow us to potentially bring them together as well to support this program for the future. I'm so proud of this community. It's times like this where the Community Foundation, when we say it takes each of us, it's so exciting to see where you see each of us coming together, where it doesn't matter what political stance we have, what socioeconomic status we have. You know, we know that this community is one of the best communities in the state of Michigan, right? Financially, we may not show it always or receive it always, but we are resilient. We have shown how resilient we are. We've gone through good times, we've gone through bad times. But if anything, we've shown how we can bounce back, right? We are here today to show how we're going to support moms and babies in the city of Saginaw, Bridgeport, and Buena Vista. That is so amazing. But I would be remiss if I didn't say that the support, the financial support that we've received so far doesn't stop, right? I guess, you know, not only being one of the biggest cheerleaders for Saginaw County, I also have to be one of the biggest people to try and attract dollars to this community. Not only bring them into the community, but what we have locally in our community. We want to support this program for the next several years. Like Dr. Mona said, it shouldn't stop today, it shouldn't stop in 3 years. We want to keep this going because we have the data. We see the results that it has in our moms and babies, and we want to keep that going. We want to take care of our community as long as we can. So thank you, Saginaw. Thank you to our partners for truly making that happen for our community. And I now have the privilege of bringing up one of our own moms who is going to share her story. So if I'd like to bring up Miss Anna Schnell, one of our City of Saginaw moms.
Good morning, my name is Anastasia. I'm currently 37 weeks pregnant, expecting my first child. I came from a pretty big family. I am the oldest out of all of my siblings, so I'm excited to have my baby of my own to love and protect. I've been working throughout my entire pregnancy, but it feels like sometimes it gets very, very stressful, and it makes it a little bit hard to be able to be totally in my element, I want to say, almost. When I heard of RX Kids, I thought it was such an amazing program to help moms feel more steady and not so stressed about having to pay the bills or making sure their family is getting fed. Baby items are super expensive too. It feels like right when you get something and it says something about a baby, it makes it a little bit more pricey. Especially laundry detergent. I'm super appreciative of RX Kids and the people that founded the program, as well as the people that are working for this program and helping fund it. They are helping so many families and making us see that we have support and we can be stable.
Great job. Thanks for being here. So appreciate it. I want to thank all of our speakers, not only for your leadership, continued support, collaboration, but just for the heart that you have for our mamas and babies here in this community. I think love is something that is a strong component of RX Kids, and I think we can feel it right now in the room, which I think is amazing. And what you heard, I think today reflects what's possible when healthcare and philanthropy and the community come together around families. So this, I think today is a powerful step forward for moms and babies and for the future of Saginaw County. And we are proud to walk this path together. So thank you all for being here. I would kindly ask everybody in the room, everyone watching, whether it's live streams or sees this video coverage of our program, to help share the news. This is actually goes retroactive, so any baby born January 1st, 2026 is eligible. And beginning next week, January 12th at 9 a.m. sharp, you can go on to rxkids.org and begin your application to get $1,500 during pregnancy, and then those $500 a month. So help us spread the word. Tell everyone you can encounter. If they live in the city of Saginaw, if they live in Buena Vista Township, they live in Bridgeport Township, and you're a pregnant mama, sign up for RX Kids. So thank you guys all for being here. Appreciate it. So, yeah. Do you guys have any questions?